A very good morning to you, and it's another Friday, and as you already know, Fridays at this time are for glaucoma awareness, brought to you by Solid 100.9 FM Enugu in collaboration with the Eye Specialist Hospital, Enugu, Nigeria. And they say awareness is the first step to prevention, and that's why we're here to help you understand the silent threats to your vision before they strike. Now, before we go into today's theme, I'd like you to do something that is a little bit scary. A little bit scary. Close your eyes tightly for about 1 hour and try to live your normal life with your eyes tightly closed. Move around the house. Try to cook without seeing. Try to use your phone or even find your way to the gate. Now, can you imagine how challenging that will be? That's just a glimpse of what life could become when blindness sets in. Today's topic, when eye pressure strikes, focuses on one of the leading causes of irreversible blindness worldwide: uncontrolled eye pressure. Eye pressure or intraocular pressure is the force created by the fluid inside the eye. Okay, I don't know so much, so that's why we have a doctor in the building. But when it builds up beyond normal levels, it can quietly damage the optic nerve, the very link between your eye and your brain, leading to gradual vision loss. The frightening part is that this usually happens without pain or early symptoms. You may still see clearly today and tomorrow, yet slowly lose sight over time without realizing it. But here's the good news: glaucoma and blindness from high eye pressure can be prevented through early detection, regular checks, and proper management. So stay with us as we unpack what happens when eye pressure strikes, and most importantly, what you can do to protect your sight. I am Uche Gabriel, and good to have you. Joining me to provide expert counsel and, of course, explanation is Dr. Sohanya Okeke. Good evening. Good morning.
Good morning, UC, and good morning, all our listeners.
Okay, so let's get started. What exactly do we mean by eye pressure, and how does it affect my vision?
Good questions. We have last week, for those of us that have been in the air life, we talked about low eye pressure and does it really mean no glaucoma? Now we have come to the next point. What is high eye pressure, and when it strikes you, what does it really mean? Now, let's start by saying that normal eye pressure is pressure between 10 to 21 millimeters of mercury. That is the normal.
10 to 21.
10 to 21. That is the normal standard. Now, for some reason, some patients, some individuals in the community, in our society, will have about 21, and some will have less than the values. These are all, they can be considered to be normal, they can be considered to be abnormal. Now, when do we really think there is a problem? Now, we have to understand one thing. Between 10 and 21 is normal. So anything above 21 is high eye pressure. Okay? High eye pressure is also known as the ocular hypertension. That is just like BP, that is called hypertension. But this is pressure in the eye, so it is called ocular hypertension. Now, ocular hypertension is this time around you have high eye pressure, but when you take a look into the eye, you are not going to have any symptoms or sign. Patient will not have any symptom. I'm having headache, I'm having pain, I'm having a blurring of vision or anything. He is not complaining. It is you who has gone to measure, knows that this patient has high eye pressure. Once the doctor sees that he has high eye pressure, his antenna is up. He now sends you for investigation because high pressure is a risk factor, one of the high risk factors for developing glaucoma.
So you're saying that I could have high pressure and still not present any sign?
Yes, you will have high eye pressure. You can still be normal, and you might have features in keeping with glaucoma. So what we do is we send the patient for investigation. Some of the investigations we want to do maybe visual field. That's you go and check how much we are seeing by the side, because what is affected at the early stage of glaucoma is your side vision. We call it the peripheral field of vision. So there might be some blind spots or scotomas we can't see. Now, we also take a picture of the eye to know how the eye looks, and we can do ocular coherence tomography or OCT to know the thickness of the optic nerve head. Optic nerve head is the wire that carries all the visual impulse, whatever we see, to the brain. And you can do all that, and there is no evidence that there is something in keeping with glaucoma. At that point, you say this patient has ocular hypertension, ocular hypertension, but then he does not have sign of glaucoma. The nerve is not yet damaged, so he remains a high risk patient that we are going to monitor for life, because it is literature, science and studies have shown that 10% of those who have high eye pressure, ocular hypertension, they did not have any symptom of or signs of optic nerve damage. So, but they can still tilt to glaucoma. So we keep monitoring them periodically. Sometimes you have high eye pressure, and then there, when we send the patient for investigation, you see that there is visible nerve damage. In that case, we are working with glaucoma. So we start treating the patient as such. Sometimes we also have to know that high eye pressure, when we record it for the first time, doctor does not pronounce ocular hypertension or glaucoma, because sometimes there are different techniques of measuring eye pressure. We have the contact tonometers, that's the standard Goldman applanation. Something will touch your eye and the doctor measures the eye pressure. We have the non-contacts where the instrument doesn't touch the eye, but now it tries to it measures the eye pressure, and if the patient squeezes the eye, there are things he will do. The eye pressure will be high. So the doctor tries to be objective, whether it is as a result of patient factors or the technician factors and all that. But a patient who comes with a pressure of 28, 30, 35, this patient actually have a high eye pressure. But these considerations are for those that have 20, 21, 20, in the neighborhood of 25. Then we also have those that have thick corneas. Cornea is the clear part of the eye, and it has a thickness. There are thicker corneas. The normal measurement is between 535 and 555 micrometers. But what it simply means is that those that have thicker corneas can have falsely elevated eye pressures, and those that have thinner corneas can have falsely low eye pressure. So we check the measurement, in which case a factor will be reduced from whatever his original eye pressure is. That tells us this is his baseline eye pressure. So these are the guiding principles before one says, yes, this patient has ocular hypertension, this patient has glaucoma. Now, when we say intraocular pressure is the pressure inside the eye, and it is the pressure is actually formed by a fluid. There is an organ in the front part of the eye called the ciliary body. It produces this fluid called the aqueous humor. Now, the it is very important for the nutrition and functioning of the physiological functions of the eye. For some reason, this fluid is produced in large quantity, so it can now give rise to high eye pressure. For some reason, there should be a balance in real time. You should have a balance between production and what is being flown out, input and output. There should be a balance, but sometimes the input is more than the output. Sometimes the output pathways is blocked. So these are the contributing factors to high eye pressure. And for some reason, for some individual, you can have high eye pressures, and these individuals don't really have any problem. Their body can stand it. The structural integrity of the eye can actually withstand all the problems, and they remain normal, and it does not translate to any problem except that there is high eye pressure.
So it means that I could have high eye pressure without developing glaucoma?
Yes, only that you will be kept under vigilance or observation, but for some reason they don't have any predisposing factors. Maybe you have a family history, you have a genetic predisposition, you have other contributing factors, your age, some other risk factors associated with it. Those ones will now say maybe weaken the system. You will now come down with symptoms of glaucoma. The optic nerve begins to get damaged. So these are the points we have to understand when it comes to ocular hypertension and glaucoma.
Okay, I don't know how right I'll be. I'm not an ophthalmologist, but it seems treatment of eye problems, I mean, the eye pressure is critical to the treatment of almost all eye problems. Am I right?
It is a basic investigation an eye care provider does, because if you come to an eye clinic, you must check your visual acuity, how much you are seeing. You must check your intraocular pressure, because visual acuity, you read the chart, we want to know how much you are reading. That does not necessarily mean if you read all the lines, you don't have glaucoma. You can have full vision and yet you might have signs of glaucoma. Even at the very late stage, you can see the whole chart. Then when it comes to eye pressure, you want to check it, because you really don't want to miss it, because is the pressure affecting your eye? Is the pressure not affecting your eye? So these are very important things. So the doctor must always check your eye pressure.
Can I know that my pressure is high without visiting the doctor?
We do not have any app, and the one touch, like blood pressure is now being checked by the phones, especially the Android phones. For now, the technology is not yet there. They are trying to work it out so that at least patients can take home and monitor the
test
eye.
themselves.
But it is still at research level, not really at the for use, common use yet.
So, but are they now? Sometimes it doesn't present any sign, but are there warnings? Are there signs, subtle symptoms that people should never ignore, especially as regards the pressure, the pressure of their eyes?
Yeah, most of the time, as we have always said, glaucoma has no symptoms. It is a silent thief of sight. It stays with you. Take away the sight, and at the end of the day, by the time you know where you are, it has taken out. Especially the type we see in this environment, the primary open-angle glaucomas, do not have signs because it knocks down the peripheral vision and not the central vision. You might be losing sight, and the eye the eyes are two in number, what one eye loses, the other eye tries to compensate for it.
Okay.
So because of that, it may be really difficult for a patient to notice it at a very early time. But as the disease progresses, you can have things like halos, rings around the light. You can have bumping into objects. Thus, you hit your objects by the side without knowing that something is there. If you are driving, you can have some accidents by the side. So these are some pointers. Your vision is going down. One other thing that can happen is your vision can get worse, especially for color. You might not have good color sense appreciation at between early and moderate stage. That's the first thing. But those of them that are very sensitive, they will tell you the colors appear faded. These are the common things. But if you have a family history of glaucoma, either in your parent, your sibling, or a distant relative who has lived in your family and died, it's a pointer that you should be checking your eye more frequently, because you don't know which generation will come down with it. So it is just do a routine check once a year. Go check your eye, and at least you will know where you are standing.
Okay, you earlier talked about a fluid blockage of the fluid, and but then I should think there should be more reasons for the high pressure in the eyes. Are there other things we're doing or not doing that could trigger the rise?
What really happens is, as I said, there can be fluid is produced very high,
Okay.
and the pathways are not there for drainage, or a pathway is the angles through which the water, the fluid drains, is blocked. So there is a problem. Sometimes it is really not that there is a blockage. There is a resistance. The place is like your kitchen sink. Your kitchen sink is, the filter is still open, but for some reason it is no more functioning the way it should.
Okay.
So what happens is fluid now stagnates in the body, in the eye, and once it stagnates in the body, in the eye, it is like when the pressure builds up, what really happens is, you can imagine the eye like a ball, but the only difference with this ball is the eye is now looking like an apple with the stem pointing backwards.
Okay.
That stem is a little bit thicker than the apple I'm talking about. So that is the wire that is sending the message to the brain. Now, the coat of the apple now is, the inner coat is the retina. Retina itself is a collection of nerve cells. The nerve cells are very tiny, and there are millions of them. They come to converge at the optic nerve head. That is the stem. That is the wire that carries the message to the brain. So at the point of exit, when the pressure builds up, there can be compression. It's like a stone is kept on the nerve itself. That is the pressure effect. It is compressing those nerves. And there is something like a filter at the back of the eye. We call it the lamina cribrosa. It is like, to put it in a very simple form, we are all familiar with filters in the house, at least sieve to filter our rice when we are cooking, and some are very thin. In some patients, this area is very thin, and through that filter, a lot of wires pass through. Those are the tiny axons, the nerves that make up the optic nerve. And when it happens, it compresses those tiny nerves, and as it compresses, the nutritional support that has to enter the nerve is compromised, and it leads to nerve death. Okay, so there is a problem. Not only that the nerve is dying, there can be a problem with the blood flow. And there are tiny blood vessels that pass through those places. And those blood vessels are also compromised, such that the blood flow to the eye is affected. So the more the compression, the loss of, when the blood is not flowing into the nerve as it's supposed to, the blood carries oxygen into the eye. You know that oxygen is very important for breathing. If you are staying in a room that doesn't have air, you suffocate. The same thing is applicable to the nerve. So the nerves now get suffocated and they die. So either pathway, whether it is the pressure that is sitting on it, or whether it is compression that is there is suffocation because of lack of oxygen, the nerves start dying. And when these nerves start dying, there will be chemicals that will be released. Human body is, a lot of chemical activities goes on. So when these chemicals are released, they elicit some more reaction such that they cause further cell damage. Wow. So it's like a cyclical thing. So one leads to the other leads to the other. At the end of the day, it's like a vicious cycle. So it keeps encouraging the death of that nerve. And that is when it happens and more and more nerves are involved, you now have peripheral vision loss. You now have complaints of all those bumping into objects and all that. So that is how glaucoma progression begins, and it keeps going on and on.
All right. How often should individuals go for an eye pressure check,
Please,
especially as they age?
Once a year is very important.
Once a year?
Once a year is an important matter.
Okay. Some have not gone for 10 years. Maybe I fall into that category. Okay, but I came the other day. I think, was it last year that I came? Or this year? Okay, it's last year. During the general eye checkup.
Okay.
Okay, so let's also begin to look at, is it possible, how can people begin to manage or reduce high eye pressure naturally or medically?
Okay. There are so many things that are out there to control eye pressures medically. Medically, you have the eye drops, you have the lasers, and you have the surgery. Much still depends on what your doctor sees in the eye, and he will now assess the type of glaucoma you have, the stage of the disease, and tell you for this type and stage of the disease, this might be the ideal option we have. Then we offer the treatment. If there is a stage you belong to, surgery might be the option. If you are at the early stage, we can work between the lasers and the eye drops. So these are treatment options available. And once you take the treatment, you can, and the doctor usually sets what you call the target pressure. Target pressure is based on the factors found in your eye. He sets a pressure that is considered safe for your eye, below which there will not be more damage taking place in the eye. So that target pressure is very critical to management of any patient with glaucoma. Now, so it's the doctor that decide which type of treatment we are going for. But on a supportive note, lifestyle modification in terms of doing exercise have been proven to be effective. Exercise at least 5 times a week, minimum of 30 minutes, brisk walk, running, swimming, aerobic sports can be of help. So these are encouraged. So it is said that it can reduce eye pressure by 10 to 20%. So it is, now when you have an eye pressure of 30 to 50, you want exercise to play a role. It will not, because if everything has its moderation.
Yeah.
So the earlier one adapt some of these things into your lifestyle, it is better than eating a lot of fruits and vegetables rich in antioxidants. That means you are going to be taking a lot of colored vegetables like green, red, and for eye, berries of purple color, red color. They are very good. They are said to mop up those toxic chemicals that are released and causing the death. Okay, so these are all lifestyle modification we can adapt.
Okay, the last thing I like us to do is to look at some of the common misconceptions associated with high eye pressure and then glaucoma generally. You note them and maybe make short comments about them. One is high eye pressure always causes glaucoma. Okay, you talk about that too. If I see clearly, my eyes are fine. Okay, only old people get glaucoma. And then eye pressure can be felt. Okay, eye pressure can be felt. And then once treated, glaucoma goes away. These are all misconceptions. And then using herbal or over-the-counter eye drops can help. Okay, and then glaucoma is caused by reading too much or watching TV. If my parents don't have glaucoma, I can't get it. Okay, eye checks are only necessary when something is wrong. And then glaucoma affects only one eye. Did you get all of them, or I should run it again?
I think maybe you could do two so that I will be responding.
Okay, two. Okay, so we'll start with the first two. High eye pressure always causes glaucoma.
Yeah.
Okay. And then the second one, if I see clearly, my eyes are fine. Okay, let's do this too.
Okay. Good questions. These are common misconceptions we hear almost every day. High eye pressure causes glaucoma. It is not high eye pressure can indeed cause glaucoma. Okay, that's what I try to make a distinction. When you have high eye pressure, you have what you call ocular hypertension. In the case of ocular hypertension, the nerve, that is the wire that is carrying the visual impulse, is not damaged. Okay. There is high eye pressure, but there is no damage to the nerve. In that case, we just have to monitor the patient. So those patients can remain normal without turning into glaucoma. But out of that group, 1 in 10 can develop glaucoma over years. Okay. But now much still depends on, do you still have risk factors, family history, age, are you short-sighted, do you have migraine, do you know so many factors. So your doctor will decide whether you want to treat the high eye pressure or we can keep monitoring. The next question is, I have good vision, can I still have glaucoma? Now you can read everything in that chart, not just 6/6, that is you read everything. There are 2 lines that is below the 6/6. We call it the supernormal vision. You can read almost everything perfect, but because glaucoma does not affect the central vision till the end of the disease, you can read everything. Okay. So your peripheral vision is what goes off first. Yes, so you can have good vision and still have glaucoma. So it's a possibility.
Wow. Okay. Eye pressure can be felt.
Eye pressures are not really felt. It is just inside your body, and that's it, except very high eye pressure. Once the pressures are too high, it will give you blurry vision, headache, pain. It can disturb you badly. But when you allow yourself to have that, you must be working on a very high eye pressure. Between early and moderate level, you may not experience anything.
Okay, using herbal or over-the-counter eye drops can help.
No, please, not at all. You know, one funny thing with herbal drugs, we don't really have good literature, good information on them. So even those that have proven values, we don't really know them. And because the doses are not regulated, it is not only, and the mode of application. Sometimes we hear that YouTube is a very good source of information, good and bad this time
Good and
around,
bad.
because we see that patients go to use YouTube, they use cucumber inside the eye, they squeeze the bitter leaf, put it inside the eye. 2 days later, they will come with wound inside the eye. So I think use of knowledge, it is not regulated with the internet, everything good and bad moves ahead. So it is very important, please do not use herbal medication without having a recourse to understand what you are doing, and do not apply anything inside your eye, because if you are treating glaucoma and you damage your cornea, then you are having two problems. Corneal damages are not easy to treat, and you might need even a corneal transplant if at all that cornea is preserved. Sometimes it can lead to an infection that can destroy the entire eye, such that you might have to remove the eye. The next thing is the OTC, over the counter medication. You know, in our country here, most pharmacies are not manned by proper certified personnel. So when they see red eyes, they all know steroids are good, so they will give you the steroid. And the beautiful thing about steroid, when the eye is red, you apply it, 2 days later your eye is clear, and it is perfect. Everything looks good.
But
And the next time this patient is not even coming to ask the pharmacist. He is going to go with that bottle and buy. The more you use that way, the steroids cause increase in eye pressure. So it now lead you to developing glaucoma. There are patients who are called the steroid responders. A small quantity of steroid is good enough to trigger a spike in eye pressure. So you must be very careful what you are taking. And on the side of herbal drugs, it is not only damaging to the eye, it can also damage your kidney. So be very careful using herbal medications.
all right, because of time, I'll leave our audience to ask the rest of a question. It's still our glaucoma awareness this beautiful Friday morning. The talk lines are open. 0704-550-2840. You can also dial 0909-771-1009. We have less than 20 minutes to go. The earlier you call in, the better. 0704-550-2840. Hello, good morning.
Hello, good morning.
Yeah, good morning.
It's Angela from Enugu.
You're welcome. Go ahead.
Okay. I just want to ask what I noticed in my eyes, like like if I say like this, I'm seeing like something like blue.
You're saying something like what?
Blue color.
Okay.
Like sometimes I used to see shadows. The light. I'm asking, is there anything that I can do to revise the sight more, the vision more?
Okay, so is it glaucoma you have? You're certified a glaucoma patient?
Yes.
Okay. All right, she will attend to you. You can do that straight away.
Okay.
Cynthia, morning. You said you feel like some shadows are in your eye, and sometimes you feel like some light color or something. Some experience you have. You can have some altered color sensation during the phase of glaucoma, and then if your pressures are high, you may have things like rings around the light. You might see like rainbow colors. That is very common. Okay, so that might point to the fact that your pressures may not be under control. Then when it comes to shadow, one might have to look into the eyes and know if there are any other problem you are experiencing. I wouldn't know if there are other conditions you might be having, that is coexisting conditions. So one might have to look into the eye, do a dilated eye examination. The doctor will put some eye drops, look into the eye and let you know what the problem is.
Okay. People normally ask, when they get visually impaired through glaucoma, do they still need to continue dealing with the pressure?
Yes, please.
Okay.
It is an important question. Some families, even patients, get fed up and frustrated that I have lost my sight.
So why continue?
Why continue with the pressure medication? Now you see that with the pressure going up without the medication, your eye pressure can go up and up and up. You can have a pressure of 50, you can have a pressure of 60, 70, and the eye loses its capacity. Sometimes you see that the eyeball keep enlarging, the cornea gets very cloudy. At that point, the patient still has a lot of complaint, headache, pain. The pain you experience can be very significant. It is really unbearable. Paracetamol or non-steroidal that is you easily buy will not solve your problem except you tackle the pressure. At that point, you must come to the hospital. Lasers can be done for you to immediately crash the eye pressure. Sometimes when you offer lasers, the question is, am I going to get my sight back? No, you are not going to get the sight back.
But it can take care of the headache and
you actually experience a lot of calmness, quietude once the lasers are done. But to prevent all that, if you are at least on a medication, then your pressures can be low so that you don't run into problem.
Okay, and of course that's why we keep saying go for checkup early. Because even after you lose your sight, it doesn't end there. You still have issues to deal with. So the earlier the better. The talk lines are still open: 0909 771 1009 or 0704 550 2840. 0704 550 2840 or 0909 771 1009. Okay. What simple steps can listeners take today to begin to safeguard their eyes from glaucoma?
Very good question. Please, I'm sure you know how important your eye to you. Your eye is the organ that gives you sense of independence. This time around, not only to earn a living, but to even move around your house, to attend to your basic needs. So if that organ plays a role in your life, taking care of it once a year is not too much. It's not at all too much. And just know that glaucoma does not really mean blindness. Okay, if you understand it very clearly, if you get glaucoma and your diagnosis is made early, you will always remain sighted. That means you can keep seeing. So the glaucoma remains with you, but you have put it under check. So you are on top of glaucoma. Let glaucoma not take charge of you. Let you take charge of glaucoma. So take charge today and ensure that you can keep seeing. God gave you eyes to see, and you owe yourself a duty to keep that structure in place. So that's my point.
Okay. You probably were not expecting this, but while we wait for the calls, how was the eye checkup that happened the other time? How was it?
The turnover was quite massive, quite massive.
And everybody was attended to?
Yes, we don't really have a situation when our patients come and we don't go see without patients don't go without seeing the doctors.
Okay.
So all patients were seen.
All right, the talk lines are still open. You can call 0909-771-1009 or 0704-550-2840. I don't know whether we're having a network problem, but then you can also use a getaway line 0813-314-2282. Ask questions when you can. And I see some people who will not participate on radio shows that bring you enlightenment, but they will start experimenting with terrible things, put it in their eyes. And if there's a part of your body that you want to use to do experiment, it shouldn't be this sensitive part. Call your eyes. I mean, if there's something you want to rub on your arms or on your legs, that's a bit understandable, but not in your eyes. The eyes is something that, in fact, the way it's created, I mean, it protects itself even from things trying to get into it. Not to talk of you now intentionally get something you don't know, a concoction, you now pour it in your eyes because you want to clear your eyes. Okay, you don't want to dabble into that. Okay, so the talk lines are still open. I don't know why we're not getting more calls, but 0909-771-1009. Hello, good morning.
Hello. Good morning. I just want to ask, is there anything that I can do to reverse the size more?
Is it what?
I'm seeing it okay, I Angela. I go back. I said, is there anything to reverse the size? I'm seeing a shadow.
Can you hear what she's saying?
Is there any drug can reverse the vision back? Again, more vision. That's
Okay.
what I want to ask.
Okay, is there anything you can put in your eyes that will give you more vision?
Yes.
Okay.
I'm seeing a shadow or something light through.
Angela, morning. I heard your complaint. I'm sure you are seeing a doctor. Your doctor knows the stage of the disease in which you are in. He will be the best person to tell you whether there can be an improvement or whether there will not be any further improvement, or whether we are working on stabilizing what you have. So it is your doctor who you are seeing that will be able to handle this question.
And you know, doctors have your medical history. They can trace it back to say, okay, this is an established case of glaucoma. Nothing can be done about it, or something can be done. So go back to your doctor. That's what it is. Unless, even if it's a test that you came, you may have to revisit so that the doctors can look at what you have. 0909-771-1009, 0902-311-1009, 0704 550-2840. Okay, we're talking about eye pressure. Maybe we need to just reiterate some of the things you've said before. So on my own, are there things I could do to relieve my eyes of pressure?
Or that is adopting some lifestyle modification.
Okay.
One of the things you can easily do is to do some exercise. 20
Exercise.
Then when you are lying on the bed, try to lie face up.
I should face up.
A little head elevated. That is, maybe put a pillow or fold the pillow and lie down. Then lying on the side is not the best.
It's not the best.
Then if you are
What about lying face down?
face down is
The
not
worst.
it is the worst. Then when it comes to when it comes to exercise also, you don't really want to do yoga, that is you put your head down.
Okay.
That is turning the body upside down is not very much useful to the eye. It rather increases the pressure. You need to drink adequate amount of water. Thus, keep drinking water, but don't rush the water. You take sips of water, gradual sips. Don't buy a bottle of water. Doctor said, yes. Doctor said you should drink water. 2 liters, I have finished for that.
Okay.
No, that one will increase. Even if you are taking the beer, no. Just take sips, put it in the glass, and start sipping.
It's better to drink from the cup.
Yes, that doesn't mean the doctor said you should go and drink beer in place of water. And then if you are a smoker, do not smoke. Smoking is not very healthy. Those chemicals I told you about, if you are a smoker, it keeps helping those nerves to die more. So you are increasing the vicious cycle. Then if you are a coffee drinker, because these days everybody has pressure, work cycle, try to minimize the coffee intake. Coffee increases the eye pressure. So these are some of the few things.
Does elongated screen time increase my eye pressure?
Elongated screen time will not give you high eye pressure, but it can give you strain on your eye.
Okay.
And you can have what you call lazy eye. You feel tired, you can have burning sensation, blurry vision. Sometimes everything looks hazy after 4 to 6 hours. Some are on the system for 8 to 12 hours. That's their work. So in between the use of your devices, what is said, every 20 minutes take a 20 seconds break, not 20 minutes break, 20 seconds.
Just 20 seconds. Look.
Less than half a minute. You blink for at least 20 times. Okay? When you blink 20 times, you can blink it yourself and you see that your eye gets lubricated very easily because the tear gland is here. It opens up. Now, one of the things that happens with screen time is that you intentionally keep your eyes open, and because it is open, the blinking mechanism is abolished. It's not there, so the lubrication is not working. It's like driving a car without oil, so you are using your eye without any lubrication, so it gives its own problem. So you complain paper sensation, burning, tearing, some bad tears. Instead of following the normal pathway to produce tear, you can have a bad form of tears comes out because it's adapt an alternate pathway. So you are uncomfortable most of the time. So in as much as we want to use the screen, let us adapt some healthy activities around us. We can also use blue light filters as eyeglass that eliminates blue light, which is very good.
Okay, I think we ended here. What will you want to say before we just go? Our time is up.
My word for all of us is please take your eye. It is one of the most important organs of the body. We need your vision, you need your sight more than me, so all of us have to ensure that we are checking with the eye doctor once a year. That is, just know that this program at least should encourage you to go to the eye doctor, have your eyes checked at least. That is very important.
Thank you so much, Dr. Sohanya Okeke. It's been a great time talking about eye pressure. To have a sweet day ahead of you. It's a beautiful weekend, by the way.